There was more than $2 million cut by Buddha to ongoing recovery and medication-assisted treatment programs beginning October 1st. It's been unclear, I haven't been able to discover, even though I've asked the questions, who authorized those cuts and whether or not you were briefed, number one. Number two, the people in the recovery community appear to be in open revolt about those cuts, and they're threatening to stage a walkout tomorrow at the governor's task force unless that becomes the top agenda item. I know that there was a letter that was sent to the Department of Health this morning talking about that. Were you ever briefed about those cuts? What do you know about what's going on?
So I don't know whether they're cuts as much as a federal program that is sunset, right? So if the federal dollars are not there anymore, that's not a cut. That means that the federal dollars are no longer available. That's my understanding. You know, it's new news to me a little bit, but we're looking into it, and we'll have more information going forward. But my understanding, they weren't cuts, physical cuts. Oh, we're going to cut that program from state funding. My understanding is that it's sunsetted a federal program that those funds are no longer available.
Well, just as a point, there were programs that were ongoing, that there appears to be other money available that's being spent on other things, and it seems to be that part of the peer recovery coaching program that has been one of Rhode Island's greatest innovations in combating the opioid epidemic is in the process of being dismantled, according to some of the people involved. So it seems that it's more than just programs being sunset, but a total revision of what's happening with peer recovery coaching.
Well, I think you explained it well. They're not cuts, right? There's a federal program that's expired. That's my understanding, at least when I came over here today, relative to continuation of programs in the help in the addiction area. I'm supportive, so we'll see where it brings us, but they're not cuts. I think that's a very important distinction between exactly what you just said. You feel as though there's money that's available in the budget that could be allocated to fill the holes. And it's also a lesson learned too, as we start talking about spending the federal dollars, that if we fund programs and then all of a sudden those programs end because the funding ended from federally and there wasn't an intention or a plan to actually fill those in with state funds, then the programs can begin, but they also have an end to them because the funding ends.